Hola friends, welcome to the Medicine, Marriage, and Money YouTube channel, the only channel for physicians who want to achieve marital interdependence and financial freedom together. On this channel, you will learn how to show up as the best version of yourself so that you can love intentionally and build a more financially savvy relationship with your spouse. And I am your host, a physician mom, a doctor's wife, a Gottman leader, a certified life and marriage coach, Dr. Kate Mangona. Welcome. Bienvenidos.
And I think it's just one of these pivotal moments of realizing how, even though I have all of this immense privilege, in my role as a physician, knowing about the immune system, all these different things, I still had struggles in navigating the healthcare system. And if that's the case, how then can I do my best to help others navigate the system, especially if they don't have that privilege?
Hello, sweet friends. Thank you so much for joining us on another episode of Medicine, Marriage, and Money. Today, we have a very special friend, Dr. Kara Wada. She is a coach. She is quadruple boarded in meds, peds, allergy, immunology, and lifestyle medicine. She is the founder, the person of the Crunchy Allergist, where she helps immune people become immune confident. And she will explain this later. She is happily married for 11 years, and how she met him was another interesting story we will get into, with 3 precious, brave, and strong children. Thank you so much, Dr. Wada, for coming on today.
Thank you so much, Dr. Kate. I'm so excited to chat with you again. It's always so much fun.
And yes, I know, because I was just interviewed by you for your upcoming summit, which is called, what is your upcoming summit called?
It is the Demystifying Inflammation Summit. What I hear both with my coaching clients and in seeing my patients in my clinical practice is this new buzzword of inflammation. And inflammation, it's kind of the new boogeyman. So I think it'll be really great to break down what is the science, what are some of the strategies that we can take when we are trying to, get control over symptoms related to inflammation. Yeah. And then how can we, develop a more resilient mindset as Absolutely. We, experience life with allergies, with asthma, with autoimmunity, with, all of these diseases of modern living that are really unified by being characterized by too much inflammation.
And I'm excited to ask you about that, because we do have a lot of food allergies and asthma and seasonal allergies in my household, which has a lot of inflammation inside of it. And I've been told all sorts of things by all sorts of people, MDs, DOs, lifestyle medicine physicians, about what we should and should not eat. And, some of those things are just really, really difficult in our household. And my husband, who's an extreme data-driven, like radiation oncologist, wants to see the numbers, wants to see the data, didn't eat cheese for his entire life, just started eating it recently. His asthma has always, it's just okay, what do we believe? What do we not believe? But first, here at Medicine, Marriage, and Money, we like to talk about your marriage, your intimate partner, and how you first met, how you fell in love. Take us back. When was this? What did this look like, Kara?
So this was back in 2006. So we met a long time ago. We were both about to start medical school at the University of Illinois. And my future dear husband had just driven all the way across the United States from Southern California, where he was born, and went to college and worked for a few years before school. And he has arrived in Champaign-Urbana, Illinois, which is a really quiet, sleepy town when there is not school in session. And medical school started earlier than the traditional undergrad campus. So the campus was done. He is moving into his apartment, getting all settled. And at the time, the social media of choice was MySpace. So, we're back then, right? And you could look up and, that's how we found many of our future classmates, where you could kind of query the system. And I don't even remember exactly how it worked, but we were able to connect. And he was like, I am so bored. It looked like you're going to be one of my future classmates. Do you want to go grab coffee or something? And I was like, well, first of all, you're cute. Second of all, I'm not in Champaign-Urbana yet. And because I grew up and lived in the very northern part of the state, about 4 hours away. And I was like, and also, I don't know you. I haven't met you in real life. And this was before online dating was like a huge thing. And I was like, I'll see you the first day of class. So then first day of class comes, I go up and introduce myself to him. And I'm like, he is pretty cute. A few weeks later, I failed my first anatomy exam and he aced it. And I was like, I need to hang out with him. And by the end of September, we had kind of unofficially started dating. So.
Wow. So thank goodness you failed your first anatomy exam.
I know. And then he likes to tell the story that by the end, by graduation, I ended up, getting AOA and, some other accolades that he did not. So a little bit of credit, but also is like, yeah, she's smarter than me, we'll kind of play it off and is like really sweet with it.
And what kind of physician did you say he was?
He is a cardiologist. He has some additional training in advanced imaging. So he gets to do all of these really cool things with MRIs and kind of some overlap maybe with the adult side of your work. And also there are a whole host of new procedures that he gets to help out with. So he's not the interventionalist doing the actual procedure, but he is the navigator, kind of getting all of those pictures while they're trying to put in these different valves or devices. So it's really cool. It blows my mind. It's totally out of my wheelhouse.
Yeah,
I think it's pretty badass.
Yeah, no, it is. And we are so thankful for it. I will tell you at the children's hospital I work at, we have a bunch of the pediatric cardiologists who read some of the cardiac MRs because our volume is just so high. And I am not trained in reading cardiac anomalies, cardiac congenital anomalies, CTs or MRs. That is read by one or two specialized radiologists in my group of 25. And I will say like 4 of them can read it, but only 2 of them want to. So we are very grateful for our cardiology imaging colleagues. And actually one of my class moms and my oldest is a cardiology imaging physician who just began. Cool. So awesome. Okay. So tell me, so you failed your anatomy exam, even though you're like super smart genius here. Totally. I will tell you that's normal because in my class, I remember so many people failed their first anatomy exam. It's like going from like the top of their class, valedictorian, and all over, Missouri and Kansas, wherever they came from to come to med school. And then they just didn't know they got caught up also in like starting college and med school. Cause I went to a 6-year program, so it's combined. And it's just different. And
yes, absolutely.
Right. So I'm sure a lot of people can relate to that and some people can't, but that's okay. So tell me, what was it so you began studying with him, but what is it like that you fell in love with? Like, what are those qualities that really you fell in love with? And are those the same qualities you still love today or how have they changed?
Oh gosh, yes. I joked, and this joke kind of takes on new meaning, I think, since the Me Too movement. But there was an evening that we went out as a group and got some drinks. And I was a little overserved, right? We weren't driving, but he walked me home and made sure I got home without any problems. I didn't get lost. No one did anything. And he was like the ultimate gentleman. Like he didn't try anything. That's kind of how the joke of how I played it off. And really that's how it should be, right? Like,
yes.
But that isn't always our experiences as women. And it really was the first inkling that like his character is just spot on. Like he continues to always put our family first as a priority. And it's like he truly is been an incredible partner, especially in parenting and especially through some of the ups and downs with my own kind of health issues as well.
Oh, yeah. That's right. We're going to get into that. So let me just ask you before you even get into your own health issues, was there any times you guys ever fought or argued or have conflict? Okay. Okay. If you see your face, that's a hell yes.
Yeah, of course. Yeah.
Get through those. Tell me, like, what is your coping mechanism, or what's that conflict dance you guys do? How do you work through that?
Yeah. I think for a long time, I think coaching has made a huge impact, at least on how I respond. I think for, many, many years, my response would be to roar back or to just completely shut down. I think even just being able to say to myself now, like, okay, what is the story you're telling yourself, like, about the situation, has been really helpful. And going back to knowing that, like, okay, whatever goofy thing, like, he's doing, like, he has a good reason for it, because that's just how he is. And so I think that's been helpful. It's also helpful to learn about how, the things that make us tick, and right, like, he is the more organized of the two of us, like, and to lean into those strengths, but also to realize, like, those are going to be some ongoing hiccups. Like, he was annoyed because I had left Kleenex. I had a cold, so I left Kleenexes around the house, and it drives him bonkers. Like, yeah, I'm sorry.
Husbands almost sound
I'll be better with that. Yeah.
My husband too. Yeah, because like, you're leaving germs all over the house. Oh my gosh, this is so sweet. Is this your youngest?
Yeah, this is Oliver. He snuck his way in. We currently, my office space is our dining room. We are in the very early stages of building a home where we will have our own offices. But
Oliver,
in the meantime,
like, he's ready to go. Okay, Oliver, let's talk about dry mouth. Okay. So
yeah.
Did this happen before? Wait, which number of kid did this happen after or during?
So after I had my second, so my second was about 9 months old, and I went for my routine dental appointment. And I was feeling pretty good about myself because I didn't reschedule it. A lot of times I'd push it out because as like a busy doctor mama, second year attending, like, you push off your own health appointments for, other kid things or sick kids. But I was there, and the hygienist said, hey, your mouth tissues look pretty dry. And it was that simple acknowledgement that something kind of clicked. And all of these little pieces of the puzzle started to fall into place. Oh, I had not been able to wear mascara or contacts for several years because my eyes were dry. I, had that conversation with my OBGYN shortly after Aki and I got married about having pain with sex because, things were not quite working right. And oh yeah, there was that back pain that I had. It was like more stiffness than pain. And it always went away when I was pregnant. And that seemed odd.
Okay. Oh, let me clarify. Okay. Oliver, your baby, your youngest name is Oliver. Was girl or boy? I forgot to ask.
Josie. Yep. My little girl, Josie. Yep.
Okay. Josie.
Yeah. Mother-in-law to the rescue.
Okay, no worries. This is real life. I have to lock the doors to my office.
I look forward to the day when I have doors. Doors locked.
So dry mouth, no contacts, back pain, gets better with pregnancy. What's that all about?
So interestingly, a lot of inflammatory conditions have what's called the rule of thirds. So about 1/3 of patients, that inflammatory symptom will get better with pregnancy. About 1/3 it will stay the same, and about 1/3 it will get worse. But typically with back pain, you're hearing your girlfriends like complaining, right? Like it's a new thing, or it's a more of a problem, right? When you're pregnant, because of all of the changes in our anatomy and our mechanics. But for me, oddly enough, that stiffness always resolved. And it reminded me so much of my patients with severe asthma that, they would not really need their inhalers when they were pregnant. They may feel a little short of breath because of losing real estate, but but weren't having exacerbations.
Wow. Yeah. Okay. And then the pain with intercourse, what did your physician tell you at that time?
Yeah. So I find it it's like the layers of an onion peeling back, because as medical students and as a medical educator, one of the things we always like teach about or talk about is like this doorknob complaint. You want to try to avoid that, because it's when the patient doesn't necessarily feel comfortable enough to tell you why they're really there until the very end of the visit. And by the very end of the visit, in the physician's point of view, you're like on to the next patient. Like, right? You got to go because you don't have that much time. But here I was in the patient's standpoint, in that fight, flight, freeze, kind of state that we get into. And it was at that very end of the visit before I actually had the courage to say anything. And this was with the doc that I really had been seeing the longest and felt very comfortable with. And I think it's just one of these pivotal moments of realizing how, even though I have all of this immense privilege, in my role as a physician, knowing about the immune system, all these different things, I still had struggles in navigating the healthcare system. And if that's the case, how then can I do my best to help others navigate the system, especially if they don't have that privilege?
Yeah, exactly. And hence the crunchy allergist born. Is that correct?
Yeah. I mean, I've been pretty open about sharing. I thought, after my diagnosis, I had kind of a pretty bad flare that resulted in a liver biopsy and a whole bunch of like shenanigans and feeling like total garbage for a while. I stepped down in my clinical role to about half time. I was really burnt out. And I also I have a 1-year non-compete in my contract. And so I was like, I need an exit plan just in case, in case I'm not able to clinically practice, or I need to find a different job. I need an exit plan. And so that's how it was born. And lo and behold, here we are. And it's really gotten me out of clinical, out of burnout, and really helped me redirect and towards what I've identified are my values, which are really leaning into curiosity and helping educate both myself and others, and helping build community as well.
So can you tell me, and I know you're laughing because you probably have kids like pulling your legs down there. Okay, that is totally okay. Totally fine. This is normal. This is expected when you have your office in your living room or your dining room. And you know what? Sometimes we don't think about this when we schedule, we fit things in when they need to be fit in. This is like real life. Come on, physician. So can I just ask you a question? Do you tell your patients who have asthma or seasonal allergies not to eat or to eat certain foods?
So in general, actually, what I love to share with people is the statistic that actually we want to have your diet be as least restrictive as possible, both from like a convenience standpoint, a cost standpoint, but also a science standpoint as well. There's some really good data to say that if you can aim for eating 30 different types of plants within a week, that you are like your health outcomes are apt to be much better than someone who doesn't eat that variety.
30 plants.
30 plants. So that sounds astronomical, right? But here's the deal. It's fruits, it's veggies, but it's also whole grains. It's beans and legumes of other types. It's nuts and seeds, as long as you're not allergic, and herbs and spices too. So what I tell my patients is, especially those that are local, we have a local like Mediterranean version of like Chipotle, and they have these bowls you can get. And then like if you go to this, this restaurant and you get their bowl and you get all the veggie varieties that you can, you're going to get like 2/3 of what you need in a week between the herbs and spices and all the legumes and veggies and greens, everything.
Okay, so yeah, I'm taking notes here because I'm going to count out how many I'm eating. Okay, so
it's a fun challenge to do.
Yeah. So wait, does the beans? You say beans count because those are
absolutely
whole grains, herbs, and spices. Okay, I do this. Here, I'm pretty sure we do this. Okay, and then what do you say about dairy? Because people have told me to not to restrict my daughter. Like she's allergic to all the nuts and seeds, and now like don't have her eat beans and.
Yeah, so dairy is a mixed bag. So dairy protein can be really great source of nutrition, especially for our young kids. And I don't take, kind of eliminating foods lightly, especially in kiddos that already have food allergies, because they're already having to limit their diet and limit some of the nutritional, or the aspects to their nutrition, right? Yes. So that's like, I don't take that lightly. Also, folks that already have food allergy, they're especially little kids, they may already have potentially some low levels of the proteins that could like signal the potential for becoming allergic. Yeah. And you don't want to take away the potential of someone developing tolerance if they haven't had clinical allergy yet. So let me explain a tiny bit better. So for quite a while, many of the laboratory companies have made food allergy panels available. Food allergy panels are going to check for like the top food allergies, and they're IgE antibodies. Those are the allergic antibodies. And the problem is if you have a little kiddo, especially a little kiddo with eczema, they have a lot of IgE, and they're going to have IgE that is elevated to foods. Now, just having an elevated level is not allergy. It's what we call sensitization. That level plus a clinical history, that's allergy. And so the worry would be if you have just a little bit of like milk IgE, but you're ingesting milk, doing okay, you're not throwing it up, you're not getting hives, you're not wheezing, you're not having a clinical reaction. If you take that out and strictly avoid it, you may end up causing allergy, because introduction through the gut is actually the best way to build tolerance. And that's what many of the oral immunotherapy programs are doing, like inducing tolerance, right? OIT, oral immunotherapy, or oral, introduction, inducing tolerance. You can use the acronym different ways.
Oh yeah, we are extremely familiar with this because my daughter's
your kiddos. Yeah. And so I think there is some concern that dairy in some instances can be a problem. In eosinophilic esophagitis, a very specific allergic condition, dairy is, it's helpful to remove dairy in about 1/3 of patients. So that's not insignificant. And what is interesting about that situation is most often a skin scratch test, like the allergy typical scratch test or a blood test, doesn't show IgE to milk. It appears to be like a different type of process. So the jury is still out on understanding, specifically, but I think when we do have really good data to say, okay, there are some areas we could really do harm, we need to avoid doing harm, right? Do no harm. And as far as we know, strict avoidance in some of these instances could be really detrimental.
Okay, that is so helpful because that means like some people should stop saying, just like if you have young kids, and they have asthma, you just need to take away the dairy. It's causing too much inflammation. Like then they could develop a food allergy to it, and they already have.
That's my worry. Yeah.
Nuts and seeds. So are you a proponent of like those powders and little chewable things that like Spoonful One or other types of, so that you can get this into your baby's gut immediately, like We're not immediately, but starting at what age?
Yeah, great question. So the research would really show, somewhere between 4 to 6 months, usually closer to 6 months, to be quite honest. The little kiddo needs to be able to sit up. Hopefully their little tongue thrust is diminishing. And that's when you should start introducing foods. And there really is there's no exact science. Okay, which one should you introduce first or last, or should you wait on certain ones? It's like, no, just start introducing them. With the exception, if you have a kiddo that for whatever reason, they are already allergic to egg, or they have clinically significant eczema, then they probably should be tested for peanut allergy before you introduce peanut.
Okay.
That is from we call the LEAP trial, which came out around 2014, 2015. Actually, yeah, 2015. It was right around the time my oldest was born. And that really kind of changed and paved the way for this early introduction and how we do that. The reason for testing is those kiddos are at a little bit higher increase of potential allergy with their first exposure.
That's what happened to me.
Yeah,
we found out my oldest, who was 6 months at the time, was allergic to eggs. So then we had to get testing before we found out, for the peanuts and everything else. But it was still not a straightforward path, I will tell you. Not like the blood work and the skin tests.
It's all evolving so quickly, and sometimes not as quickly as we want. But so some of those products are helpful. There was one product in particular, and I forget which, so forgive me. But there was one that was cited because it did not have enough of the protein in it to really make it as helpful. So, if you're looking at a product, I would look who's on their scientific advisory board. Do they have a board certified allergy immunology doc on the team? Like, that would be helpful. Have they studied it specifically? That probably would be helpful to look for. And then, if that makes things easier, great. If it stresses you out more, don't. In general, I try to minimize overly processed foods in our house within reason. I try, no never foods, but for us, giving my kid a handful of bamba, which is an Israeli peanut puff. It kind of looks like a Cheeto. It's total kind of quote unquote junk food kind of thing. But for us, that was such an easy way to keep Josie and Ollie occupied while we were finishing dinner. They're getting their peanut in. It helped their little gums, that were irritated. And I was like, this works this is some processed food they're getting, and it is okay.
Oh my gosh, Kara, do not come over to my pantry, please, because we have a lot of processed foods, and these kids, they eat. But yeah, bambas are healthy. I mean, that's where they get the peanut powder.
Yeah.
Okay, awesome. So one other question I wanted to ask about this, this particular topic with food allergies and inflammation. So the EOE, eosinophilic esophagitis, and you said it's helpful to eliminate dairy in 1/3 of those cases. How do you know that they have, what are the first symptoms? Because I know when you're doing oral immunotherapy or when you have food allergies or asthma, EOE can sometimes play a part. So what are the symptoms you watch out for in your kids to know?
Yeah, so symptoms can vary somewhat based on age, but things you're going to want to look for in kiddos, food refusal, refusing to eat, maybe they're regurgitating food, other thing, depending on the age, they're probably not going to say, "Mommy, I have heartburn," right? They're not going to know to say that, but more tummy aches. And then in little kids too, failure to thrive also is something you can see. In adults, a lot more often we'll see food impactions, or they'll mention when I eat bread or rice or chicken in particular, things that are drier or might get stuck more easily, meat steak, they can get impactions or feel like food's getting stuck. Chest pain, heartburn, that's not going away. So all of those would be reasons to get evaluated. One frustrating thing with EOE is we do not have a non-invasive way of diagnosing. So the diagnosis has to be done by endoscopy or a scope and looking, getting biopsies, looking for those eosinophils under the microscope.
Yes. Okay. Yeah, we almost went that route. And then a few years ago, actually right before the pandemic, so about 3.5 years ago. And then we decided to see a GI physician before, because we were just going to go there and get the endoscopy all at once. But then we ended up going and figuring out she had emotional vomiting, and it wasn't actually from food allergies or from EOE, it was emotional. And we could tell that because she would throw a tantrum and then she'd vomit. And so she did it every time we put her in the car and every time she went to sleep. And it's just hard to figure that out because, also she was also getting all the colds from school and vomiting. And then also her food allergies kept popping up new things and vomiting. So it was just hard to see when you were in the thick of it. Absolutely. Is there anything else, Kara, that you want to share in regards to, your upcoming summit, inflammation in general, demystifying inflammation, or allergist?
Yeah. So one quick, parting wisdom that I wish, and people told me, but I think, no, we can't say it enough. It is not your fault, mama, if your kiddo has food allergy. So I was diagnosed with Sjogren's about within 2 weeks of Josie actually having an anaphylactic reaction to eggs. And I totally blamed myself for not addressing my own health. I told myself all sorts of stories in hindsight about how it was my fault. And I did something that caused it. And we do the best we can with the knowledge we have, the bandwidth we have, the capacity we have at that time. And so just, that is my little love note to all the mamas out there listening that, you didn't do this. It's not because you didn't breastfeed long enough or, give them all organic stuff or make them play in the dirt. And we're going to continue to learn things. And that's what I think is so cool about the summit. So we're going to be hearing from experts from across the gamut of various specialties. So Dr. Leo Trisande is going to talk about endocrine disruption, its role in inflammation. He is an internationally known expert on endocrine disruptors. We're going to hear from one of my former mentees, who's now in faculty at Vanderbilt, about the role of exercise in asthma and why it's so important if you have asthma to be exercising. We have things across the board. Several of my dear rheumatology colleagues, we're going to demystify autoimmune labs and medications. And what I'm really excited about is this is kind of like an open secret now, but the summit is 3 days long. It's free. But my dear friend and business collaborator, Jennifer, and I are doing a bonus day on the 4th day, and it's building kitchen confidence. So really kind of how can you grocery shop, more effectively and, increase kind of that anti-inflammatory, power of the groceries and things you're buying. What do you actually need to look for? How can you meal plan and make that work for your family, whether you're the one cooking or not, whether you like cooking or not, so that you can really tap into the power of your beautiful brain when you're, thinking about how we're nourishing our body. And so,
awesome. Well, I'm so excited. We're going to include the link in our show notes or below.
And we're hearing from you.
Yes. Yeah. Oh, yes. I will be there. I will be there. I'm sharing my journey about having a child with food allergies and how traumatizing yet that caused a lot of growth for me. And my daughter is beautifully thriving, still in the program. So how I like to close my interviews, Kara, is I like to talk a little bit about finance and money. And so we've got two very intelligent physicians here, the mom and the dad, the cardiologist, cardiology imaging, and who quadruple boarded here, who does the books, who writes the checks, who does the investment?
My husband. Yeah, absolutely.
100%.
Pretty much. I mean, I do my business related stuff and I help manage childcare kind of things and groceries, but he kind of steers the ship. And I think is much more thoughtful and interested in those sorts of things as well. And I think he makes about twice as much as I do. So that probably helps too.
Either way. So I just spoke
Yeah.
with a very dear colleague earlier today. We had lunch, and her husband did all of the finances 100% of the time for about 20 years. And she made all the money. She made all the money, but her husband did it. And unfortunately, he was doing things that
Oh
helpful,
no.
right? So even if you like, it's
Yeah.
nice to have eyes on.
Oh yeah.
Oh, yeah.
Yeah. Yeah.
How,
We have joint account. Like we each have kind of our little slush funds, but we had joint accounts and touch base and file our taxes together and yeah.
okay, awesome. And so when you say
Yeah.
your slush funds, do your incomes both go into the same account and then you put a set aside some for your slush fund or?
No, so we already had our account set up before we got married. And so then we kind of move funds to like the joint savings along the way.
Okay,
Yeah.
so your
It's a little
income
bit of a mess.
both go into set. So your income goes into yours, his goes into his, and then you join them.
Yeah.
Okay,
Yeah.
awesome.
Yeah.
Everybody does things a little bit differently. That's why I like to.
Yeah. And it probably will be a time to think about, is this how we want to keep things or do we want to adjust things? Especially as we're embarking on building a new house. So
Yes. Maybe simplify things, like make it easy. Can you just put it all into the joint and then slush away?
probably.
Well, it was so nice talking to you, Dr. Wada. Thank you so much for coming on and talking about your journey through your own diagnosis of Sjogren's, through and also your beautiful, just how you speak about your husband and how you actually speak about him, which warms my heart.
I'm so totally smitten with him.
Oh my gosh. I love it. So thank you so much. And just tell people where can they find you if they want to reach out to you.
Yeah, so the easiest place to find me, my website is Dr. Kara, Kara Wada, WADA.com. And on socials, I am at Crunchy Allergist.
Awesome. Yeah. Okay, and I might have already shared a little snippet on Instagram and Facebook stories, so go check it out.
I'll go repost.
Tag you though, because I was so intensely captured in your interview answers.
Went out with my little guy sneaking in.
That's right, Oliver. Okay, say hi to your family. So much love.
Bye. Take care, Kate.
What a beautiful interview with Dr. Kara Wada. I will say I have been wanting to talk to somebody about this inflammation and pediatric allergies, immunology. That's always something that I'm always interested in discussing. So bless Kara's heart for coming on to my show, for interviewing me for her summit. So excited you guys could witness that. And now for my take home points. Number 1. Always give your spouse the benefit of the doubt. Did you see how she did that? She started with, saying he has a good reason for it. And I forget what she was talking about, but he was doing something that probably wasn't in complete alignment with what she wanted him to be doing or something. And so she's like, he has a reason. He has a good reason for it. And wouldn't that be an amazing thing to say next time you see your spouse on their phone, sitting on the sofa, not doing the chores you asked them to do, but just thinking to yourself, she, he, they have a good reason for it. And oh, I know what she said. It's like she said, whenever I see him doing something goofy. So maybe it's goofy, maybe it's silly, maybe it's frustrating, angry, like stupid, whatever it is your word is. Can you just give them the benefit of the doubt? They're being a human. They're being themselves. They feel like they can be their authentic self around you, even though you may not receive it in the best way initially, maybe frustrated or irritated. You have a good reason for it. Number 2, eat 30 plants a week. Okay, y'all, let's start us a food log. 30 plants a week. What'd you eat? I can tell you I ate cauliflower, green beans, snap peas, tofu. Is tofu a plant? Because it comes from the soy. I think it's a legume. Cashew, And I'm sure I had some spices and herbs in there. List all of your, and this, 30 plants a week. That's already like 5 in one day. And then if I can add spinach, banana, apple, orange into there, got this. Eat 30 plants a week. That is the magic number to keep your autoimmune health in check. If I'm even saying that correctly, remember, Dr. Wada is the one who helps build people's immune confidence. I am just the messenger for her today. So go eat your 6 plants today, and then do that for the rest of the week, or go eat your 5 plants today. And dairy, take it or leave it. If your body doesn't like it, don't eat it. If it doesn't mind it, embrace it. Okay. And number 3, Mama, it is not your fault. It's not your fault, Mama. Don't blame yourself. Don't beat yourself up. Hindsight is hindsight. Okay, there's a reason that we have that word. We do the best we can with the information we have and the capacity we contain in this moment. Same thing with last week and the week before and the year before. Say we got married young, and that was all the information we had. Is we learned this from our parents, we learned this from our socialization at school, from the society. We married. Now we want to explore other options. We figured out our values don't match theirs. Look, sometimes it takes years to figure this out, to go through this personal growth journey on your own. Same thing with medical issues, chronic illnesses, yours or your children. Maybe what you did 30 years ago in your marriage was not what you want to do in your marriage today, but you want to stay married to the same person. So maybe you're feeling stuck and you want to reach out to somebody. You want to say, how can I shed some of this anger and frustration? I love them. He's a good man. She's a good woman. They're a good human being. I will tell you exactly what Dr. Wada said. Sometimes we need a coach to guide us, to reflect our thoughts back at us like a mirror that we're refusing to look into ourselves, or with a slightly different reflection or bend. Magical. Sign up for a 15-minute discovery call if y'all have not already. And let's begin your path to becoming unstuck. Share with a friend, a physician, a family member who really needs to hear these words of advice, whether it's to do with allergies, immunology, parenting, husbanding, wifing, spousing, or finance. Share, subscribe, send me some love, write a review. So much love, my friends, to you and your beautiful family. If you are finding the concepts I teach in these episodes useful and want more in-depth and personalized support for your relationship, consider this your invitation to join me in creating the most connected and intimate relationship with your spouse that you could dream of. Go to www.medicinemarriageandmoney.com right now and download my 18-page medical marriage survival guide and workbook at no cost to you. I also have a 6-day marriage challenge, which goes over the 6 predictors of divorce at no cost to you. These have been known to decrease fighting, rumination, and grudges between you and your loved one. If you want to take it a step farther, really enhance the joy and connection in the most intimate relationship in your life, sign up for my 8-week Making Marriage Work program today at medicinemarriageandmoney.com. Thanks for leaving us a stellar review, subscribing, and sharing with your friends on social media. You have the power to improve someone else's life and marriage simply by sharing this episode. Much love to you and your spouse. You're exactly where you need to be in this moment. Adios, my friends. The content of this episode is not intended to be a substitute for professional, medical, or financial advice. The opinions provided on this episode are those of myself or the invited guest alone. They do not represent the opinions of any particular institution. Always seek the advice of your physician or financial advisor with any questions you may have of a medical condition or financial plan. This is for your entertainment only.